Welcome to this lecture on the Arkansas Trauma Communications Center, or ATCC, and the trauma banding system. As an EMT, your ability to communicate effectively and follow trauma protocols can mean the difference between life and death for your patients. In this session, we'll break down how ATCC works, why trauma banding is essential, and how you can ensure your patients receive the best possible care. Let's get started. The Arkansas Trauma System was created to provide rapid, organized, and effective care to trauma patients. This system isn't just about hospitals. It starts with you, the EMTs on the front lines. Every second counts, and proper communication with ATCC ensures that trauma patients get to the right facility as fast as possible. But communication alone isn't enough. We also use trauma banding to track patients from EMS to hospital care, ensuring no patient falls through the cracks. Understanding these systems makes you a more effective EMT and helps save lives. So, what exactly is ATCC? Think of it as mission control for trauma transport in Arkansas. ATCC is staffed 24/7 with professionals whose job is to coordinate patient transport and make sure hospitals aren't overloaded. When you call ATCC, you're not just notifying them about a trauma patient. You're activating a system that finds the best facility for your patient based on hospital capacity, injury severity, and transport logistics. Without ATCC, EMS providers would be making these decisions blindly, potentially overwhelming smaller hospitals or delaying care. It's a vital part of trauma management in Arkansas. Alright, let's talk about how you, as an EMT, communicate with ATCC. In Arkansas, we use the Arkansas Wireless Information Network, or AWIN, for secure EMS communication. This ensures that hospitals and EMS can exchange information in real time. When calling ATCC, always use a structured format. Identify your unit and location. Give a brief patient summary. State the mechanism of injury and any life-threatening conditions. Provide vital signs and treatments given. Estimate time of arrival, ETA. The faster and clearer your report, the better the coordination. ATCC will then guide you on the best transport decision. Imagine this. You're on scene at a major car wreck. One patient has severe head trauma, another has a broken wrist, and a third has multiple lacerations. Who needs to go where? That's where the Arkansas Trauma Triage Protocol comes in. Major trauma patients, those with life-threatening injuries, must be taken to level 1 or 2 trauma centers for immediate specialized care. Moderate trauma patients, such as those with fractures or minor head injuries, can be treated at level 3 or 4 trauma centers. It's your job as an EMT to assess the patient's condition and provide ATCC with an accurate report so they can guide you to the right facility. The Trauma Dashboard is one of the most valuable tools we have in Arkansas. This web-based system provides real-time updates on hospital capacity, so ATCC can direct EMS providers to the closest available trauma center. Why does this matter? Because overloaded hospitals slow down patient care. By keeping track of hospital availability, the Trauma Dashboard ensures we don't waste precious minutes transporting a patient to a facility that's already at capacity. Always follow ATCC guidance on which hospital to transport to. It's based on real-time data, not guesswork. As an EMT, you play a critical role in the trauma system. Your responsibilities include following ATCC communication protocols. This ensures smooth coordination of care. Providing accurate and timely patient information. Your reports help ATCC make life-saving transport decisions. Collaborating with ATCC and hospital staff. Effective teamwork ensures trauma patients get the care they need when they need it. Never underestimate how important your role is. A well-prepared EMT can make a massive difference in patient outcomes. Now, let's talk about trauma banding, one of the simplest, yet most powerful tools in the trauma system. Every patient suspected of a traumatic injury should receive a fluorescent orange trauma band. These bands are pre-printed with unique alphanumeric codes that allow hospitals and EMS to track patients seamlessly from pre-hospital care to hospital discharge. Think of it this way. If a patient is transferred multiple times, their trauma band ensures that no information gets lost. It's a small step with a huge impact on patient care. If you suspect any type of trauma, band the patient. This includes car crashes, falls, burns, near drownings, dog bites, attempted suicides. Even minor trauma cases should be banded. Over-triaging is encouraged because these bans are cheap, effective, and vital for tracking trauma patients. When in doubt, band them up. As an EMS provider, you should place the trauma band on the patient before transport whenever possible. Then make sure you record the trauma band number on your EMS run sheet. Notify the ER staff about the trauma band. Ensure the hospital records the band number on the patient's chart. If a patient arrives at the ER without a trauma band, the hospital staff should apply one immediately. Every facility involved in the patient's care should document the trauma band number to prevent errors or lost records. Trauma bands provide 3 major benefits. They link EMS and hospital records, ensuring smooth transitions between facilities. They improve data quality, reducing errors and duplicate records. They allow for seamless tracking of a patient's journey through the trauma system. Many trauma patients require multiple transfers. Without proper tracking, vital information could be lost. Trauma bands eliminate that risk. Like any system, the trauma communication process has challenges. Common issues include radio congestion, too many people talking at once, poor signal quality, especially in rural areas, incomplete reports, leading to confusion at ATCC. The solutions? Use alternative communication methods when necessary. Follow a structured report format. Stay up to date on ATCC training. Preparation and clear communication will help you overcome these challenges and provide the best care possible. ATCC and trauma bands are the backbone of Arkansas's trauma system. Your role as an EMT is critical in making these systems work. Communicate effectively, follow ATCC guidance, and always apply trauma bands when needed. These small steps can make a life-saving difference. Thank you for your dedication to patient care. For more information, check out the Arkansas Department of Health, Arkansas Trauma System website, the ATCC Preferred Radio Report format, the Arkansas Trauma Banding newsletter. Stay informed, stay prepared, and stay focused on saving lives.